Hey everyone, EG here. Today I'm going to be talking about the horror that has happened in our healthcare system as far as particularly costs. I mean, there's lots of ways you could look at the healthcare situation in the US, but I'm focusing on the costs today because I just got nailed by that. And so it always gets my anger up when I experience the absolute insanity of the greed of the healthcare system. It just astounds me. So let me give you some backstory to this as far as, what I'm going to talk about today. I have noticed in the last 40 years at least how healthcare costs have gone up insanely in this country. And I'm talking about in the US. For those of you that are watching my channel from Europe, if you're not aware, we're the only industrialized nation in the world that does not provide free basic health care to its citizens as a right, not a privilege. This has been a flaw in our system for decades. It has never gotten resolved, even though there were a couple of opportunities where we could have instituted what's called single payer system, but it wasn't done. And so now we're still coping with that. And the problem is we're also the only industrialized nation in the world where people have to file bankruptcy because of their medical costs. And that's insane. No one should ever have to do that. And the reason I'm so passionate about this is I grew up with a military healthcare system in this country, which really was socialized medicine. That's what it was. It was free. Everyone got the same care. There was, you didn't ever have to pay a penny out of pocket. That's the system I was born into. My dad was an Army officer, and until I was actually 21 years of age, I was entitled to free medical care. I just assumed that's what everyone got. Didn't even occur to me that there was a different system out there. Now, back in the 60s and 70s, when I was growing up, the healthcare costs were not as high, even comparatively to people's wages, as they are now. So now it's like a runaway train on healthcare costs. But back then, it was relatively more affordable. And if you did get healthcare through your employer, they basically paid, you didn't even usually pay a premium out of your paycheck. And the employer's plan paid for most healthcare. And that was probably during, I'm guessing, the 70s, 60s and 70s. It started to change in the 80s. And of course, by then I was off the military funded healthcare at the age of 21. And I started seeing the healthcare costs. But it didn't really get bad until the 80s, when I was already close to 30 and in my 30s. And then I started noticing it was the rise of the HMOs. And the HMOs basically started nickel and diming you. They started charging for, oh, you have to do a copay here, or there's a deductible here, or whatever. But again, they weren't out of control yet in the 80s. It didn't start to really escalate until the 1990s. So it wasn't horrible yet, but it got there. And the basic problem is that unlike other industrialized nations in the world that after World War II went to basically a healthcare system where it was provided to all citizens. Of course, citizens would pay taxes and that would go in towards this fund for healthcare, but people basically got healthcare. In the early days in Europe and in other industrialized nations, people got that healthcare for free. And in some places, it's still totally free. I mean, yes, you do pay taxes into that, for that, but everyone gets to benefit from that. So the US never set up that kind of system. In the US from the very beginning, except in the military where it was totally subsidized by the government. In the rest of the country, they set up a system of healthcare that was for profit. In other words, these big corporations began to be in control of the healthcare system. They were the insurers. And it actually is not just the insurers, it included the pharmaceutical companies, everyone associated with it. So they justified it because, oh, we have to pay the doctor so much money because they have to pay so much to go to medical school, which again, in other countries is not the case. Doctors who study medicine in Europe do not have to pay the exorbitant costs that they do in the US for medical school. So they aren't under the same kind of financial burden. So this for-profit system is the heart of the problem. Because anytime you have a for-profit system, you're going to have greed. And the greed of these healthcare companies and the pharmaceutical companies knows no bounds. And this has been increasing for the last at least 30 years tremendously. So that's kind of the backstory of the history of what's causing this problem. But I want to share with you my own perspective on this just as a person who, you know, has suffered from this system for a lot of my adult life. So actually starting back in, I think it was from 2006 to about 2016, I went for 10 years and I couldn't afford medical insurance. I was working at a community college as an adjunct faculty. I got no benefits. And they started having the exchanges when the Obamacare went through, I think in 2009, basically. But I did go on that exchange, I think, for like 1 year, but I couldn't even afford that. The premiums were outrageous even then for someone at my age. I was in my 50s at that point. The premiums were insane, and I basically couldn't, there was no doctors. There was no doctors that would take it. So then what was the point of being on the insurance? So the whole system, even when they tried to reform it, was really flawed. So I basically went 10 years without health care. And for the most part, it worked out because I didn't really have to go, for most of that time, didn't have to go to an emergency room. I went to like just urgent cares and paid out of pocket when I got like, you know, a virus or something like that. I would get yearly blood work done and just pay. They had a system, I was in Arizona at the time, where you could go and you could just get, you know, your blood tests done. Like once a year, they would come and draw your blood at like a supermarket. And it was through a regular drug, you know, like laboratory. And I'd only pay like $100 a year to get my blood done. If they had done that through insurance, they would have charged 6-7 times that amount. So the thing is, there were ways to get things done. And fortunately, the only prescription medication I was on was thyroid medication because my thyroid was taken out in 2005. So that was really cheap. So I never had a lot of costs during that year, those 10 years, except in 2013 when I had to have emergency surgery. I had no insurance, but because it was life-threatening, they had to take care of me at the hospital. And I had my gallbladder removed, but more importantly, they saved me from dying because I had pancreatitis from a gallstone that caused that. So I ended up having a huge hospital bill. I mean, huge. And they lowered it because, you know, they reduced the cost already because I didn't have insurance. I think I still owed close to $20,000 for that. And I know originally it was probably even more than that. And I couldn't pay that. I wasn't making the kind of money to be able to pay that. So the thing is, I basically had to file bankruptcy. Because, I mean, that was a huge part of it, was that medical bill. So I got nailed by the system, you know, through no fault of my own. I had no say, you know, I didn't know I was going to have you never know you're going to have emergency surgery for something medical. So now I got re-triggered by this because for 6 years, until the end of last year, I was basically covered under a Medicaid program in California. So I had both Medicare and Medicaid, and that basically covered everything. I never had to pay anything, which was great. I mean, Medicaid has its problems, though. You still don't get the best care if you really need it. Like if I needed, I didn't have any major medical problems during that time. If I had them, I don't know what kind of care I honestly would have gotten, but at least I was grateful to get it for when I had it. But of course, once I started making more money, I basically had to give that up. I lost that, you know, and I can't be on Medicaid now. Not that I'm making a ton of money with YouTube, but I'm making enough that I don't qualify for Medicaid. So I'm now currently on a Medicare Advantage plan that started October 1st. But before that could even hit, for those of you that know what happened to me, when I came back from Europe, I came down with COVID, really sick. I did not want to go to the hospital or, you know, emergency or urgent care initially, because I guess it's glad I didn't, because I might have had 2 visits I had to pay a ton for. And I really was trying to avoid that because I knew I just had Medicare at that point. I didn't have the additional Medicare Advantage plan. So Medicare is supposed to be paying 80% of your costs, which you would think, oh, that's good enough. No, apparently not. Because in mid-August, I had a blood pressure crisis it was an aftershock effect of the COVID. It was doing this particular strain of the virus was causing that in a lot of people. And because I'd never had blood pressure problems before. And all of a sudden I had massively high blood pressure this one day where it went up to like 212 over like 110. Well, I went to the emergency room because that's what you do when you think you're going to explode, apparently, from blood pressure. And I was a little worried because I thought, great, now I'm going to have a bill from this, right? But when I checked in, I gave him my Medicare card. I had been to this ER before, so they had my previous thing, and I said, I don't have that other, I'm not on Medicaid anymore, but I gave him my Medicare card. And I said, you know, and they didn't ask for any other money at that point in time. So I was in the ER. I mean, listen carefully to this. I was in the ER a little over 3 hours. And in that 3 hours, I didn't even see a regular doctor. I saw a nurse practitioner, and I only saw her twice for maybe a total of 20 minutes. Okay, that's the doctor visit. And in that a little over 3 hours, they ran a chemistry panel on my blood. They gave me an EKG. They gave me just a normal chest x-ray and a COVID test. That's what I had done. Nothing really super invasive. I didn't have a CAT scan. I didn't have an MRI. Didn't have any of those things. So I was thinking, this can't be that bad. You know, it'd been a long time since I'd been in an ER that I saw a bill, because when you're on Medicaid, you know, you don't even know what they've charged. So I started getting a bill about, I guess, 2 or 3 weeks ago. They're emailing them to me, basically. And so I look at the bill, and then I'm putting on my glasses I'm hoping you will be able to see this on camera. So this is the bill, and I thought this was the only bill, but this is the bill from the hospital. Now, I don't know if you can see up here, but I'm just going to kind of put it up to the camera. There. Okay. You can maybe see that. The total charges for my little more than 3 hours from the hospital was $3,238. Are you freaking kidding me? I mean, I'm just saying that because I'm sorry. There's no way that that's that much money. Okay. Now they did take off. They basically took off what they said they received from insurance and provider adjustments. And then what the amount, Medicare, I think only paid like $569, but then they adjusted it because it's way overpriced. Obviously, they're gouging people. And so the bottom line is they say I owe them $730.58, which is about 3 times more than I figured it would be. I figured I might owe a couple $100 maybe for that. And obviously don't have the money to pay that all at once, and I'm not going to pay that all at once, and I'm going to write them a strongly worded letter and explain how little time I spent there and how is it this much money? And then explain to them that I'm a senior citizen who still is living on a lower income. I don't have a high income. and that there's no way that I can pay this amount. That's not even the beginning of it. So then I get a letter, again through email, or a bill through email, for this other service, which I didn't even know was a thing, where they charge you separately for the doctor that saw you. Again, saw maybe the doctor for 20 minutes total. I get a bill, and I was trying to pull it up to show it to you, but I can't. It won't come up properly. I get a bill that's for the physician's services. Again, how bad can that be? And it was for $920 and something, some odd change. And I go in to look at that. Now they say they didn't receive anything from my insurance company. Okay, well, that doesn't make any sense. Medicare should be paying 80% of that too, which would mean the part I owed would be $180, $190, which is still ridiculous. But the point is, so now I sent them a message and said, how did you not even bill Medicare for this? Because there's no way Medicare wouldn't have paid something for this. Of course, Medicare probably looked at it and laughed and said, that's ridiculous. $920 for seeing a physician like twice in 3 hours? Come on. This has gotten out of control. Now it's created a big problem that I've got to fight for. I've got to go to battle for this. I've done it before for medical stuff. But I mean, it's been a while. I haven't had to do this in a long while. But the thing is, it shouldn't be this high. And I'm sure you guys know this. I'm sure you've had situations like this too. I mean, if I'd had a choice, I never would have gone to the ER in mid-August. I was trying to wait till I had additional coverage. Because like right now on the Medicare Advantage plan I'm on, I only have to pay a maximum of $125 to go to an ER. That's all they can charge me. But see, I knew I was gonna have to pay some. I just had no idea it was gonna be that much. You know, if it'd been a couple $100, you know, I would have managed that. I could have made, you know, done it in 3 payments or something if I had to. Most people can't pay an unexpected medical bill of, if they don't deduct for Medicare on the physician part, they're basically asking me to pay about $1,800 between the two things. That's frickin' ridiculous. I was covered 80%. That doesn't even make any sense. So I'm on here on a rant because this just speaks to me to the larger injustice of this whole medical care system. I don't ever want to be in a situation again where I have to have medical bills so bad that I'm going to have to file another bankruptcy in my life. It shouldn't happen to anyone. Something has to change in our system, but I don't know. It's not going to happen probably in my lifetime. Who knows when it'll happen? But for those of you out there that are watching this that are younger, please keep fighting for this in your life. You know, let your representatives and senators and local politicians or whatever know that this is insanity to have a system like this. Absolute insanity. You know, I couldn't help think when I got those bills, I thought, you know, if I'd had that happen when I was in Europe, anywhere that I was at in Europe, and I'd had to go to the ER in Europe, first of all, there's a good chance I wouldn't have had to pay anything. And second of all, even if I'd had to pay out of pocket for the same thing they did in that ER, it probably would have been just a few $100s at most. And that's with having no insurance, which I technically had insurance, but I probably would have had to pay and then get, reimbursed or whatever. But the cost wouldn't have been that high is my point. It would have been more manageable. We're living in insanity, and I've watched this increase my whole life. I know I'm preaching to the choir to a lot of you out there, but there are people in this country that still just don't get somehow how bad it really is. And they think, oh, well, I like my doctor. It's not about liking your doctor or not liking your doctor. It's about the costs involved and what you're getting. And they're gouging you. Now, between that $3,200 and something they charge me for being in the ER and doing those minimal tests for 3 hours. Then they had the nerve to charge me $900 and something for a doctor's care who wasn't, if the doctor had been sitting with me the whole 3 hours, I guess it would have been more understandable. But I barely saw the doctor twice. And it wasn't even a doctor. But the point is that, so basically, they're saying that my 3 hour and few odd minutes was basically worth $4,200. That's what they're saying. That's ridiculous. That's my rant for today. Stay tuned. I'll just give you update. I won't do another whole video about this, but I had to give you that, I needed to talk about like why I have followed this injustice most of my adult life, and that I've seen it just escalate, ruin people basically because of these costs. And now it's potentially going to get even worse because people are going to see their premiums go up. I know like for Medicare Part B, our premium is going to go up. So it's any increase in Social Security that would happen in January is completely canceled out by the increase in Medicare Part B. So there's no increase. So you don't get a cost of living increase at all. So anyway, that's my thoughts on that. Please share in the comments below if you can identify, commiserate, understand in some way. But yeah, now I have to fight. Now I have to go into battle for something I just didn't really want to exert energy for, but now I got to do that. So, because that's the only way you can deal with it is sometimes you just got to fight. So, I mean, through letters, of course. Anyway, thank you all. Until next time, be kind. Keep moving forward. Take care. Bye.